British health authorities are rolling out initial doses of the world's first widely tested and independently reviewed coronavirus vaccine today. 90-year-old Margaret Keenan received the very first shot on what the country is dubbing V-Day. The first 800,000 doses are set to go to nursing home workers and people over the age of 80 who are either hospitalized or already have outpatient appointments scheduled. In the U.S., Pfizer's vaccine could be approved for use by the end of this week as cases continue surging across the country. Earlier today, the agency released new data on Pfizer's vaccine, indicating it's in line with its guidance on emergency use authorization. So Charlie D'Agata is outside the hospital in central England where the first dose was administered.
It is the shot seen around the world. First on the globe to receive it, 90-year-old grandmother Maggie Keenan made history.
I would say go for it. Go for it because it's free and it's the best thing that's ever happened. So please go for it. That's all I say.
Poetically, second to go for it was William Shakespeare of Warwickshire. Even a 99-year-old World War II veteran. They're the first to be inoculated today with the Pfizer BioNTech vaccine, which was granted emergency approval here only last week. The vaccine will initially be administered from around 70 hospital hubs across the UK to people over 80 and some frontline health workers, before being rolled out to thousands of temporary vaccine centers, including converted parking lots, sports stadiums, even race courses.
I mean, it's amazing to see this tremendous shot in the arm for the entire nation, but we can't afford to relax now.
Not with a death toll of 61,000 and climbing, one of the highest in the world per capita, even higher than the U.S. The UK has ordered 40 million doses, enough for 20 million people. The U.S. has an order in for 100 million doses pending FDA approval. After shielding for many long months, Maggie is now hoping to see her family again in the new year. There may be a long road ahead, but now there's a route out.
All right, so for more on this and other news around COVID-19, let's bring in Dr. Dyan Hes. She is the founder of Gramercy Pediatrics. So thanks for joining us. The whole world now is watching how the UK unfolds when it comes to the vaccination of thousands of their residents. So what might the US be able to learn from the UK's rollout of the vaccine ahead of the FDA's own authorization?
Well, I think just the organization and the planning that takes, they said they're going to use stadiums and parking lots. So I have to tell you that we're here in New York City, and yesterday I spent the whole day trying to figure out, I got an email saying, if you want to distribute the coronavirus vaccine, please respond to this email. And it took like 80 steps to figure out that I actually was already enrolled in a program, if the coronavirus vaccine was going to be rolled out in New York City for kids, that I am actually enrolled because I'm in the city immunization registry. But that took us over like 2.5 hours to figure that out. And I'm just worried that the planning, because the United States is so diverse and every state is so independent from each other, how are we going to do this seamlessly? That's going to be the hugest challenge. Like, even for doctors, we don't know where we're going to get our vaccines yet, if we're going to get them. They keep on saying the first responders are getting them, but we haven't been told where, when, how, and that's supposed to come in like the next 2 weeks.
Yes, that is very concerning. And then you add to the fact that the Pfizer vaccine and Moderna vaccine, the other sort of leading contender, they require 2 doses. So now we have to make sure that people come back. And if the process is as complicated a second time, there's a risk that many people won't come back. Some experts are saying, and this is an expert in health payment mechanisms and patient incentives at the University of Michigan's Medical School. That person estimates that as many as 30% of the patients who get the first dose of the COVID-19 vaccine will not return for the second one. So how might vaccine efforts be undermined if people only get one of the shots and they don't get the second one? Well, we don't know, because that wasn't what was studied, but we're assuming that their titers, the antibody titers, won't become high enough to prevent coronavirus vaccine. So the first one might be a primer for your immune system, and the second one completes your immunization, so you're not going to really be immunized. We have the same issue with infants. When they get their first
their first flu vaccine, it's 2 shots the first year. And I have to tell you, it's very hard to remind people. You have to come back in a month to get the second half of the flu shot. And people often forget because they're like, oh, we got the flu shot, we're done. So it's just going to be a lot of public education, reminders. I think this is where like social media and text messaging can be super valuable. So like once you register and you get your first vaccine, I think you should get like nonstop text messages reminding you, please make sure you made your appointment for your second vaccine, things like that.
And so with the emergence of, a coming vaccine, of course, there are all new questions about our behavior. How do we have to change our behavior? And a lot of people are wondering, if you do get vaccinated, do you still need to wear a mask?
So eventually, I think we won't. But I think until we know that this vaccine is working, we are going to have to wear a mask. And I think that's going to be very hard to enforce because people are going to think this vaccine is like a pass, like you're going to have a passport that you're vaccinated. But we don't have the clinical trials to show that the people who are vaccinated are not shedding the virus. They might not be getting sick, but they might not. But they might still be shedding if they got it. So they still have to wear their mask.
Okay, so we know that once the vaccine becomes available, the elderly in nursing homes, frontline workers, those who are more vulnerable to the virus, they all sort of be part of the first round. But there is a concern about children. There's new data released by the FDA on Pfizer's vaccine, and currently there's currently insufficient data to make conclusions about the safety of the company's vaccine on children younger than 16. And this comes after Moderna announced last week that it would begin testing its coronavirus vaccine on children ages 12 to 17. How different are children's immune systems than adults, and how likely are these companies' vaccines to work on children the same way they work on adults?
Well, I'm not an immunologist, but as a pediatrician, what I believe is that actually the children have a stronger immune system, so they might not need as high a dose of the vaccine to build an antibody response. And actually, children, the vaccinations last for much longer, so their immune system is much stronger. That's why, for elderly people with the flu vaccine, sometimes in the past we've said, wait until October to get your flu vaccine because we want it to last through March for you. Whereas a child will say, come get your flu vaccine the minute we get it in September 1st. So they might not need as high a dose, but I believe that it will work just as well. I don't think that they'll need so much tweaking. I don't think it'll be like an overdose or something like that. I think it'll either work and it'll last, and we might just not need as much, or we might use the same exact dosage. We'll see.
Okay, so we talk about, vaccines, we talk about all that, but we all know, because we said it over and over again, that really the vast majority of us won't have the option of getting vaccinated until sometime next year, hopefully the springtime. And so we have to make it from here to there. And we're seeing cases surge. There are projections of over, 500,000 deaths because of the coronavirus by April 1st. California has issued some really strict guidelines, new lockdown measures for people. They're not allowed to interact with people who are not in their household. I'm wondering just how effective you think this will be when it comes to curbing death numbers, and I think also taking into account and this is the balance that I know a lot of officials have been trying to strike, that, the more restrictive you become, does that mean that some people may become less compliant because it becomes unbearable for them? And so it's always a balance that you have to take. But when you hear about the restrictions in California, do you think it will make a difference when it comes to deaths eventually?
I don't. I think that extreme lockdowns are too harsh, that people are burnt out from having this pandemic. They're broke. I think poverty is just as big a problem now as coronavirus, and I think starvation, hunger, and depression and suicide are going to go through the roof. I can tell you that I am a private business owner. Okay, I'm a doctor, but I don't work for a hospital. I spent all my life savings on PPE. And I'm just thinking, okay, so let's say a restaurant has spent all their life savings to reopen their restaurant with all of these guidelines: partitions, air circulation, air filtration, outside dining. They spent all this money. They brought their staff back only to be shut down again. These people are broke. I mean, the loan, if you got the loan, that lasted about 8 weeks max. Hunger, starvation, poverty, it's going to be through the roof, and I think these extreme measures don't work. I personally think if you wear a mask and wash your hands, That is the most important thing, but we have to leave the economy open and the schools open at some level, because you're going to have many, many other repercussions from coronavirus that are much worse than the coronavirus itself.
Yeah. You know what I'm hearing from you is sort of two things. That, the basic instructions that we got from the very beginning are the ones that will make the biggest difference. Wear the mask, social distance, wash your hands. But also, these restrictions need to go hand in hand with some sort of federal support. Whether it's, back to the Paycheck Protection Program or something, in order to keep people going until we can get to the other side of this. When you have one without the other, then you run the risk of people not complying with the restrictions because they literally need to survive in some way. Dr. Dyan Hes, thank you so much.
Have a good week.